talk about something called narrative medicine with the conference founders. We have Dr. Elizabeth Lahti here and April Brenneman. Both of you founded this conference. Doctor, I want to start with you because I had never heard the term narrative medicine before, and I want you to just explain what that is exactly.
So narrative medicine is a framework that can be applied to any healthcare encounter, and it was originally described and developed by Dr. Rita Sharon, who is at Columbia University in New York. And really, at its core is medicine practiced with narrative competence, which is the ability to listen, absorb, and really be moved to action by the stories of illness and wellness.
April, probably a good way to understand it is to know your story and how you came upon narrative medicine.
Certainly, yes. My son was diagnosed with cancer in 2004 when he was 4, and so through that journey as the patient advocate, aka mom, I did a lot of writing and trying to figure out and process and understand, what we were going through as a family, what my son was going through cancer treatment and beyond. I also ended up creating artwork by painting on his x-ray and discovered that this is considered narrative medicine. So it's really the crossroads between science and art. And art speaks to us in deep ways that other venues don't. So this was something that really caught my attention, and then I reached out to Elizabeth and we decided to bring a conference to the West Coast.
I was just going to ask why you started the conference and what need did you feel, what was missing that this kind of fulfilled that need?
I feel like narrative medicine is a way to help implement patient-focused care. And the healthcare providers are in a system that sometimes isn't always focused that way. And this is a way to help on both sides. For a patient advocate like myself, it was a way to reflect on what was happening, to be able to tell the story, have those stories honored. And on a physician side, it's about them being able to reflect too, because they're experiencing as a healthcare provider, all kinds of experiences that might be difficult and hard.
From a physician's perspective then, do you see it promote healing in a different way?
I do. I think that the best healthcare providers are people who are centered and reflective people who can bring their own stories as well to the clinical encounter, and also have a way of processing the kind of fluctuations of intense things that we see. You can go from one patient room where somebody is dying to another patient room where somebody has just received wonderful news. And I think the ability for care providers to recognize the stories that we are a part of, and to see where our own stories meet that is really important in order to be as attentive as we can as a team.
And Doctor, you were saying the conference is open to anybody, anyone who would like to learn more. So that is the Northwest Narrative Medicine Conference running October 20th through the 22nd. It's there on your screen. You can visit nwmcollaborative.org. Elizabeth and April, thank you both so much for being here today.
Thank you.
Thank you.